So as people settle in, having grabbed their coffee, so what I'm going to do is I'll just quickly introduce myself and then I'll introduce our speaker. So my name is Patrick Fafard. I'm a professor in the Graduate School in Public International Affairs here at the University of Ottawa, and I'm cross-appointed to the School of Epidemiology and Public Health in the Faculty of Medicine. My great pleasure to introduce Benjamin Mason-Meyer to our conference. He has graced and been nice enough to come and speak to my students on occasion, and so I have read some of his work. As most of you know, he's a professor of global health policy at the University of North Carolina, Chapel Hill, senior scholar at the O'Neill Institute, which most of the people in this room I think will know as the O'Neill Institute for National and Global Health Law. And he is the current chair of the Global Health Law Consortium, which makes him a friend of the Global Strategy Lab, and I'll talk about that a little later. But perhaps most importantly, he's a prolific author and editor and has written and edited several incredibly important books in the general area of health and human rights, including works for teaching purposes as well as more conceptual work. And so it is very appropriate, and I'm quite delighted that he's able to join us this afternoon. So I will turn things over to him. He'll speak, and then I will have a couple of brief comments after that, and then we'll move quickly to Q&A. So, perfect.
There we go. Perfect. Thank you. Merci. Bon après-midi. It's really an honor to join you here in Ottawa in thinking about how we can commemorate best the 75th anniversary of the Universal Declaration of Human Rights amid these ongoing global health law reforms. The University of Ottawa has long been at the forefront of both human rights law and health law, and Professor Habibi has really brought these two together, offering a truly unique opportunity to advance human rights obligations under global health law. This interdisciplinary imperative for global health law, as Alicia raised in her opening keynote, could not come at a more crucial time. Human rights have risen over the past 75 years to become central to global health. And yet the COVID-19 pandemic has shaken the foundations of human rights and global health governance. In the coming months, as we've discussed throughout the day today, reforms of global health law offer a path to strengthen human rights, to meet future public health threats, to meet future public health emergencies. Will we take this path? Examining how we will face future pandemics. It'll be crucial in our conversations, both now and through the panels this afternoon, to really analyze the long evolution of human rights law to advance global health over the past 75 years, to think about the lessons that have been learned through our COVID-19, I believe the last panel called them abysmal failures, and to think about the reforms that are required now in order to rebuild our world, to face future global health threats. So good afternoon again. Grateful for the kind introduction. I'm Benjamin Meyer. I'm a professor of global health policy at the University of North Carolina at Chapel Hill in the States. I'm a scholar at the O'Neill Institute for National and Global Health Law. And I come today and until the end of this year as the chair of the Global Health Law Consortium. It's been inspiring to support the Global Health Law Consortium in our efforts to advance policy development through our collaborative scholarship. And I'm excited to share with our groundbreaking work some of the things that we've developed over the past 3 years with the International Commission of Jurists, thinking about the ways in which we've worked together to frame human rights principles in public health emergencies. In the development of these principles, I've remained grateful for Professor Habibi's steadfast leadership, bringing together scholars and advocates throughout the world to align and synthesize our efforts over 3 years. I'm honored to join her in this symposium today and to think about how we can strengthen the fundamental importance of human rights law and global health governance. in considering these principles as a foundation by which we can shape these global health law reforms. We recognize that the past years have brought unprecedented challenges to human rights and global health. How can we look to human rights law now in order to build back better? Facing these challenges in my own work, the past 5 years have seen us develop 3 new books and a series of articles to really shape human rights in the global health response to COVID-19 and to help to frame global health governance, both through the COVID-19 response and as we look ahead to future public health emergencies. And so drawing on these 3 books and also also our new quarterly column on global health law in the Journal of Law, Medicine, and Ethics, I hope to frame our afternoon discussions by thinking about the role of human rights over the past 75 years, but also in the pandemic response. To think about the ways in which this response has raised an imperative now for human rights obligations to shape the future of global health governance. I look forward to opening this conversation with Professor Favard, and we've already begun that conversation over the lunch break. I hope that this introduction helps to shape some of our conversations through the 2 panels this afternoon, to think about the ways in which we can overcome the very discrete human rights challenges that we've seen, but to look more broadly at how we can overcome ongoing challenges in these unique moments when we have the opportunity to develop global health law reforms. And so I'll begin today, there we go, by framing human rights and global health governance, really drawing from our first book on rights-based governance to try to help us understand how global health has sought to implement human rights in global governance within the World Health Organization and across the United Nations. In focusing on these obligations, I'll then, there we go, draw from our foundational book on foundations of global health and human rights to detail the limitations of human rights, limitations in national responses to COVID-19, and international efforts to realize vaccine equity. With those vaccine equity failures highlighting the limitations of global solidarity through WHO governance. Given these governance limitations that highlight our failures to develop human rights and global health law, I'll end by looking at our most recent book, published just last month, and consider the WHO reforms that are necessary to bind states together in facing future pandemic threats through ongoing negotiations to revise the international health regulations and to develop a new pandemic accord. In focusing on these issues, my work focuses on human rights frameworks in national and global health policy, focusing on the development, the implementation, the application of human rights in global health governance. And focusing on this, oh, that was supposed to be pretty and colorful and did not turn out to be. But I hope to think about the ways in which we can look at human rights under international law as a basis for global health through this Venn diagram. The ways in which we frame health disparities as rights violations, as we discussed this morning, really offers us international standards, not just to talk about injustices, but to establish legal commitments, to clarify state obligations, to evaluate policies and outcomes under law. And this has given rise to a health and human rights movement that has shaped the human rights that underlie global health over the last 75 years. It's these human rights that underlie health that arise out of the 1948 WHO Constitution and the UN's Universal Declaration of Human Rights that we commemorate today. Please work.
In 1948, as the world sought to rebuild from the horrors of the Second World War, 2 documents came into force that have shaped the health of the world's people for more than 70 years. One was the Universal Declaration of Human Rights. The other was the Constitution of the World Health Organization. Both affirm that health is a fundamental human right, not a privilege for those who can afford it,
And so it's this fundamental application of a right to health, born 75 years ago, in both birth of the World Health Organization and the Universal Declaration of Human Rights, that it becomes so central as a foundation for the conversations that we're continuing to have today. 5 years ago, we developed a 70th anniversary article to focus on the ways in which WHO was challenged prior to the pandemic. Today, we are focusing on the ways in which the pandemic has challenged this further. And this was a placeholder on the slide for the article that is coming out, I'm told, at 2 o'clock today, that will focus in PLOS Global Public Health on the ways in which human rights have been challenged in the global response to the pandemic. And I regret that I can't share it prior to my talk. And yet we recognize the ways in which human rights have come to be understood to be essential to global health, that they've offered universal frameworks for the advancement of justice in public health. And as a basis for justice under international law, human rights have evolved under international law, from the Universal Declaration of Human Rights to a binding covenant to a series of international policies that we'll discuss throughout the day today. Standards by which we've sought to frame government responsibilities for the idea of health as a human right. And we've sought to develop policies, programs, and practices to protect public health. And so in developing these policies, programs, and practices, I want to look ahead to the 21st century and the turn of the century, where the United Nations sought to establish human rights as a central focus of all the United Nations activities. As international organizations across the United Nations began to consider how human rights would impact their policies and their programs. When UN Secretary General Kofi Annan spoke for the last time to the UN Commission on Human Rights, his 2005 address sought to acknowledge the shift toward what he called an era of implementation, stating that the cause of human rights has entered a new era. Our focus has been on articulating, codifying, and enshrining rights. That effort produced a remarkable framework of laws, standards, and mechanisms, beginning in the Universal Declaration, but including covenants and much else. He said such work needs to continue in some areas, but the era of declaration is now giving way, as it should, to an era of implementation. It's this era of implementation that would require the support of international organizations. And Secretary General Annan called on the entire United Nations to mainstream, as he called it, mainstream human rights as a cross-cutting focus across all UN activities, all programs, all policies, all practices. And this mandate for mainstreaming in global health governance has required that organizations progressively incorporate human rights norms, standards, and principles into their policymaking practices, into their operational budgeting issues, into their bureaucratic processes, and ultimately into the organizational culture that drives the members of the Secretariat forward. In developing this shared human rights-based governance across the United Nations, human rights would be seen to bring together different sectors, different organizations, united in common goals for the advancement of global health. And yet these developments now face existential threats. These existential threats, largely predating the pandemic, largely coming from the rise of right-wing populist nationalism, has seen nations sought to retrench themselves inward at the very moment when global solidarity is needed most. In violent contrast with the global solidarity that is required for global health, and that we've spoken about in the early discussions today, populist politicians have sought to undermine the vision of common humanity that has structured our global health efforts over the past 75 years. These populist politicians have rejected public health science, denying public health data as a basis to neglect the health of the public. They've denied human rights, as we've discussed, restricting civil society, repressing vulnerable populations. They've undermined global solidarity through institutional attacks, with my own nation going so far as to withdraw from the World Health Organization. I'm sorry. And yet, as we noted early in the pandemic, these attacks on human rights and global governance would prove devastating in the pandemic response, undermining our shared values, our shared response to this cataclysmic threat. These nationalist retrenchment led to the rejection of both global governance and human rights as a basis for public health advancement. And in responding to these unprecedented threats, we need to examine these failures. We need to understand the human rights limitations that we faced in the COVID-19 response. In this COVID-19 response, we saw many early fundamental limitations of human rights that would set the tone for the response as we move forward. From the initial outbreak, we saw how delayed notification hampered WHO's ability to understand the scope of the threat and to coordinate the international response, delaying the WHO declaration of a public health emergency of international concern, and delaying global preparations for a pandemic response. Moving into February, we would see the world turn dark as governments responded to this public health emergency with overwhelming restrictions on international travel, individual rights, and global commerce, with these national restrictions often violating explicit WHO recommendations. Professor Habibi's early work in the pandemic response brought together the Global Health Law Consortium to focus on these early violations of restrictions on travel bans. This early scholarship would lay the foundation for our continuing international legal analysis to support WHO governance. In our subsequent report to the independent panel on pandemic preparedness and response, we would go on to detail the ways in which human rights were violated in the early days of the pandemic response, detailing challenges to the right to health, in health system preparedness, and focusing on limitations of social and economic rights of vulnerable groups, especially during extended lockdowns. We would also look at limitations of civil and political rights that were undertaken by governments purportedly to protect public health, with governments often using public health as a justification, as I said earlier, to repress specific vulnerable populations. We would see violations of obligations of international assistance and cooperation, undermining global solidarity to this shared threat. Instead of coming together in collective action, states reverted to isolationist policies, discriminatory attacks, global neglect, exposing the global community to humanitarian upheaval, to health insecurity, to human rights violations. And these rights violations have endured in meeting international obligations to ensure vaccine equity, leading to many of the conversations in our opening panel this morning. How can we make vaccine equity a reality in global health law? Global health governance has proven unable under the current legal system to mitigate this threat to global health and to human rights, despite frequent pleas from leaders to place human rights at the forefront of the global response. From the start of the pandemic, we would see global leaders looking to human rights as a basis for the global response, with UN Secretary General Antonio Guterres recognizing at the very beginning the challenge faced by human rights.
The COVID-19 pandemic is a public health emergency, but it is far more. It is an economic crisis, a social crisis, and a human crisis that is fast becoming a human rights crisis. In February, I launched a call to action to put human dignity and the promise of the Universal Declaration of Human Rights at the core of our work. As I said then, human rights cannot be an afterthought in times of crisis, and we now face the biggest international crisis in generations.
And so these pleas from leaders across the United Nations system, from the World Health Organization to the United Nations, the Office of the High Commissioner for Human Rights, have been neglected by national governments, leaving the world more divided than at any time since the end of World War II. This unprecedented threat raises an imperative now to reaffirm a universal commitment to human rights, to recognize the importance of human rights in our global health efforts, considering the ways in which rights can provide a framework to prevent, treat, and respond to infectious disease threats across nations, and to bring the world together in global solidarity to ensure the highest attainable standard of health for all. As we meet at this moment, as we commemorate the 75th anniversary of the Universal Declaration of Human Rights, reforms of global health law will be necessary to facilitate this international legal accountability for human rights and global health. And as we look ahead, we recognize that WHO is now mobilizing its member states to establish new authorities that are necessary to realize the promise of global health governance. The Global Health Law Consortium is supporting these reform efforts as a basis to empower WHO. Developed through legal mechanisms discussed earlier today, we recognize that WHO has the constitutional authority to negotiate regulations, conventions, and recommendations. And these authorities are now being applied in amending the international health regulations and developing a binding pandemic accord or treaty. Rather than reviewing these law reforms that have already been addressed this morning, I hope to end by discussing our ongoing work to support human rights advancements in the development of the pandemic accord. How can we develop global health law in a way that will strengthen human rights, that will meet our imperatives for equity, that will ensure global solidarity? The COVID-19 pandemic has revealed deep flaws in the global health law framework, exposing human rights violations and weakening the World Health Organization. But this flawed response offers a unique opportunity to reform human rights authorities to strengthen WHO. This new pandemic treaty can seek not only to construct strong authorities that reflect good public health practices, but can also advance the right to health and human rights principles in global health. And our ongoing scholarship, published in 15 minutes, will detail obligations under the right to health to prepare for future pandemics, considering reforms that are necessary both within and outside of the health system. It can clarify the application of necessary and proportional human rights limitations in responding to a public health emergency. And it can obligate states to ensure international assistance and cooperation as a foundation for global solidarity in facing our common threats, especially in access to medical countermeasures. That was a central focus of our last panel. To this end, non-governmental organizations have been pushing through a civil society alliance on human rights in the pandemic treaty, pushing to advance these rights. The Global Health Law Consortium has come together to support them, working alongside the International Commission of Jurists to detail human rights principles in public health emergencies. I remain grateful to Professor Habibi for working tirelessly over 3 years to synthesize our efforts, to bring these principles to completion. These principles are the central focus of our discussion this afternoon. The COVID-19 pandemic has been the greatest health crisis of any of our lifetimes. But the human rights limitations that we've seen in this public health response offer us now this unique opportunity to launch transformational reforms of global health law. Through our work on the pandemic treaty, and we'll discuss some of the intricacies of it as we go along this afternoon, we seek to understand how human rights obligations can provide us with a path to overcome nationalist challenges in the pandemic response, to repair the World Health Organization's leadership in ensuring global solidarity. As states move forward in the coming months to codify these human rights obligations under global health law, whether explicitly focusing on human rights obligations under international law or implicitly advancing human rights norms and principles. This innovative pandemic treaty, to the extent that it can come to fruition, could provide a transformative model for global health solidarity in facing our common threats. But it will require states to overcome nationalist forces to meet this global moment. And so as we look to human rights as a shared path to prepare for new challenges, we recognize the ways in which human rights have brought the world together in unprecedented cooperation over the last 75 years, drawing from the ashes of war to provide us with a foundation for common solidarity in facing our collective challenges. And yet all of this is now at risk as populist leaders pursue isolationist efforts that threaten the continuing existence of human rights and global health. We face common threats that require our collective response, raising an imperative to harmonize international human rights law and global health law. Can human rights obligations under global health law provide us with a foundation to overcome nationalist challenges in pandemic responses? Can it provide an opportunity to strengthen our institutions of global governance as a basis to advance global health, global equity, and global solidarity? Where the COVID-19 pandemic has presented a world-altering threat to global health, it will be urgently necessary to reshape global health law. But human rights can provide us with the opportunity to come together, to address our collective threats under universal norms of global human rights. Can we build from this moment of division and loss to build a better world? It has been inspiring to work with scholars and advocates to respond to these challenges through the development of the guidelines and principles on human rights in public health emergencies. And I look forward to working with many of you here, especially those on our panels this afternoon, to think about how we can implement these principles in national law reforms and in global health governance reforms that will reshape our world for the threats to come. Thank you so much.
So thank you very much. I'm just going to take a couple of minutes to make a couple of observations, and then I'll open it up to Q&A. And I guess what I should mention that I am not a lawyer. I am not a human rights specialist. I come to this conversation through the door marked public health and global health governance. I should also mention that I come to this through work with the Global Strategy Lab and Stephen Hoffman, who started the lab here at the University of Ottawa and started the Global Health Law Consortium. And for the most part, I've left, conceptually anyway, a lot of that work to my colleagues. But I teach a course in health and human rights to undergraduates. So what I'd like to do is just throw out a couple of questions that non-lawyers and my students would ask as we think about the kind of world and the kind of challenge that Benjamin just laid out. So I guess the first question I would invite us to all think about is, he described international human rights law as a rallying point, a conceptual rallying point to overcome some of the nationalist and populist impulses. And I think at that level, I mean, we could have a whole conversation. But one of the questions I try and get my students to think through is, what practical work, what actual change does a human rights frame actually bring to improve health? And then the rejoinder question, one of many follow-up questions is, and does that make a difference about what kind of, what country we're talking about? Because for Canadians, this is all a bit unusual and odd, because we live under a world where we have taxpayer access to health care and we have a Charter of Rights and Freedoms. And it takes a lot of effort to explain to people that this is the exception by far and not the rule. And so it's helpful if there are examples of how this could all make a difference. And then the second question I would throw out, just as we think about this, is what is our expectation of the pace of change? And so, yes, absolutely, the pandemic has been a low point, a demonstration of what political scientists call realism, or at best neorealism. That is the proposition that at the end of the day, states will act more and less in their own self-interest. How can we, given sort of that low point, what does success look like? And one of the questions I encourage my students to think about is our goal, or is the goal, or is the impact of international human rights law or building human rights principles into global health law one of creating law, or is it one of creating norms? And then what are our expectations about how norms actually begin to shape behavior? And at the end of the day, that's where I think from an interdisciplinary perspective, there's a whole bunch of work that doesn't get called human rights law, but it gets called sort of like, how do we build international norms? And I think there's a whole conversation that can be had of other efforts, notably in global environmental cooperation, that is not about creating legal instruments, although it can be that, but it's also, and maybe even more forcefully over at least the medium to long term, how do we build up some international norms? And to end on a positive note, I guess the other thing I learned from my students is that now there's a bit of self-selection going on. These are students in a program where they self-selected into conflict human rights, but they actually have in the medium to long term a very optimistic view that the global level is the level at which we should cooperate. And so I think there's an expectation on the part of at least some citizens in many countries that this is actually the way the world's got to be. And so I think that's a basis upon which we can build out. So I will shut up, and I'm happy to play referee a little bit and take some questions and comments.
Hello, YY Chen from the Auto. So my question, or perhaps something for us to also consider in this discussion. So let me kind of preface what I'm going to say. So I think a lot, Ben, thank you very much for your very helpful keynote and very insightful points. And I think in a lot of your discussions, you talk about how greater involvement of international human rights in the global health governance structure would help improve things, right? And which I believe, wholeheartedly that may be the case. I wonder at the same time whether there are also lessons to be learned when international human rights law currently falls short, and whether by learning from those failings of international human rights law could also benefit the further development of global health law. And what I've, one example that I have in mind has to do with the global management of the refugee population, right? So in that context, the idea of solidarity has been long in existence. And the idea of responsibility sharing is also something that's firmly established. And yet, even with those pieces in place, we don't always see a very positive outcome in the management of refugees globally. So I'm wondering whether simply talking more about global solidarity in itself is sufficient to mobilize our improvement of global health law and governance, or perhaps there's something more that we need to learn, right, from the existing implementation systems of international human rights law that's required.
So I'll pick this up with something that Professor Papar ended with, which is this question of, have we really made progress? Is there hope? When we think about the human rights system, yes, we are commemorating the 75th anniversary. but 75 years in institutional terms is still rather young. When my own country's constitution was 75 years old, we were about to fight a civil war that would possibly extinguish the entire dream. So things have steadily improved, not steadily, things have sporadically improved, I'll say, in global health and in human rights, at times in parallel ways and at times in interconnected ways. And speaking to your first question about those interconnections, it's really not until the early 1980s, really the early years of the HIV/AIDS response, that we begin to see a traditional rights-limiting approach to public health, named reporting, discrimination, quarantine, really being questioned. And for the first time, it became clear, both in civil society and in the World Health Organization, that there's an inextricable linkage between health and human rights. That the best way to improve public health is to focus on promoting the affected communities and making sure that we're realizing rights. Those of us in the human rights space would say, even if it didn't promote health, it would still be the lowercase r right thing to do. It would still adhere with our notions of common humanity, even if it didn't improve health. But the idea that it improves health really solidified the case for the World Health Organization. And that brings me to your second point, which is the question of what happens when we don't live up to these ideas. And it both builds on this idea that we are still a young system, we are still ironing out the kinks in all of this and trying to understand how we can advance human rights and mainstream them in practice. But it also highlights the importance of international efforts learning from each other about the best way to make human rights real. Because when we talk about the failures of our refugee system, our asylum system, some of that is around limitations of the norms themselves, where governments deny the existence of the common norm. And some of them are just bureaucratic procedural hurdles. We're not doing it the right way. And one of the early lessons that came out of our first book, which looked at human rights mainstreaming across 20 different UN agencies, is that they don't talk to each other about how they're mainstreaming human rights, and that there's a lot they can learn from each other. This morning, we heard a great deal about efforts within the ILO, and the ILO is so much better at developing normative standards than the World Health Organization. They exist within 100 meters of each other as headquarters, and they never cross paths. And so there's a lot that can be learned about human rights mainstreaming as we begin to focus on different issues. So part of it is about bottom-up civil society movement building. Some of it's about top-down bureaucratic mainstreaming of human rights and governance. And some of it, sadly, is the political realm, that the states need to get involved in the middle and develop some of these norms. And that's the challenge that we see at times in the refugee space, at times in the global health space, and right now in the human rights space, especially in an increasingly divided and increasingly right-wing populist world.
Question over here. Wanna- the mic?
Thank you so much. When I was listening to you, what was occurring to me was the kind of debate we have heard between intellectual property and human rights. And that kind of tension whereof, from one perspective, IP can reinforce or empower human rights. And then human rights can support intellectual property. Now it depends on who you ask, whether you are an author or whether you are somebody who is receiving benefits of intellectual property without actually having an invention. So what I want to ask you to reflect with us is, why do you think that global health and human rights are not mutually reinforcing as they should? Where is the source of this disconnect? I mean, your presentation has really hit the right buttons, but at the end of the day, that is really the question. Because when we talk about human rights, we talk about global health. I would have thought that global health will be an avenue to enforce human rights or to realize the benefits of human rights
So why would these two systems that are supposed to be mutually reinforced themselves be in complete disconnect to create this kind of crisis?
The challenge when these organizations don't collaborate. Does this work? Yeah, okay. So this is the challenge when the organizations don't communicate with each other, that we see these regimes, these legal regimes that are operating in different directions, whether it's global health, human rights, trade, intellectual property specifically. We're gonna have more conversations, of course, in the panels this afternoon. I know that Lisa Foreman, Sephora Abdul Karim will be speaking about some of the human rights challenges in intellectual property. A lot of the consternation that came out of this debate between intellectual property and human rights comes out of the early years of the HIV treatment response, where it became clear that 90% of the HIV positive world couldn't access treatment because it was unaffordable, and it was unaffordable because of intellectual property regimes. That the flexibilities that were in the World Trade Organization's TRIPS agreement were not sufficiently flexible to allow countries to develop these compulsory licenses for needed HIV/AIDS medications. Out of this debate, the World Trade Organization itself came in Doha to see the need for reinforcing the imperative for flexibilities, or what we now are focusing on, waivers of intellectual property in the context of a public health emergency. Now, our last panel recognized that the flexibilities that were reinforced in Doha in 2001 still were not sufficiently flexible. And there was a fear in our last panel that if we simply reproduce the language of the Doha Declaration in the pandemic accord, we have gone nowhere, because the Doha Accord, for all of its bold language around human rights, for all of the human rights advocacy that led into it, has not been successful in ensuring flexibilities under the TRIPS agreement. And so there needs to be a greater recognition under the pandemic accord. And this afternoon's conversations will think about what those flexibilities will need to look like. I think coming out of our last session, what I come away with is the idea that at the end of the day, the World Health Organization, or the member states of the World Health Organization, can say whatever they want in a pandemic accord. States will still defer to the World Trade Organization and the TRIPS agreement on a lot of these discussions because of the accountability that's created under the World Trade Organization under its dispute settlement system. Now, what the pandemic accord could do is provide a new starting point for negotiations, a way of putting WHO member states on record that the balance, as you said, between intellectual property rights and human rights is badly skewed in favor of intellectual property rights at the expense of human rights and health. And this could provide an opening for then having further discussions within the World Trade Organization. But we need to recognize that even the most binding legal instruments are themselves just part of, I think earlier we talked about normative shifts, that this is about changing the norms around how individuals, how governments, how international organizations think about the world around them, so that human rights, at the end of the day, establish a taken for granted quality, that we no longer think of them as legally binding obligations. We just do them because we do them. And we have not reached that point yet in thinking about the role of intellectual property rights vis-a-vis global health and human rights. The pandemic accord can be the start of that conversation between WHO and the WTO and the World Intellectual Property Organization. But that is an evolving debate that will take many more years to resolve, I feel.
Question over here and then here.
Thank you, Professor Meyer. Craig Phillips, School of Nursing here at the University of Ottawa. Also, I will reveal, American-born Canadian. So I get why you're apologizing, but that's also one of the things that I want to push back on you about is With regards to human rights, oftentimes the US perception and perspective is the way we do things are perfectly fine here. We don't need to worry about the whole human rights regime and things like that. As advocates or activists or folks interested in advancing and moving in a direction towards human rights, what suggestions do you have for actually countering and helping our fellow citizens in the US to recognize and move forward with human rights?
So I will say, as someone who's been teaching a health and human rights course now for 15 years, it's been inspiring to see students increasingly over the years recognizing human rights have a place in the world, have a place in the domestic conversation. In the United States, as you may remember, there was this landmark moment during the 2008 presidential election where then candidate Barack Obama was asked, healthcare, is it a right, a responsibility, or a commodity? And he came out after some hemming and hawing to say that healthcare was a human right. And that paved the way for having a conversation around the Affordable Care, what would become the Affordable Care Act and healthcare expansion in the United States, efforts to look beyond healthcare in the United States to larger underlying social determinants of health. It would re-engage the United States in the human rights mechanisms of the United Nations under the Obama administration, where they would specifically point to healthcare reform as a way that the United States was seeking to realize the right to health. And it's opened up a new conversation for students, but this has always been a tension. And I was talking before the panel with Professor Fafar about some of my historical research to try to understand how the right to health became so enmeshed in Cold War debates, Cold War conflicts between the United States and the Soviet Union. So much so that the idea of talking about a right to health was seen as itself inherently communist. We've come a long way since then as a country. We now have the ability to talk about human rights in domestic policy, to talk about a right to health specifically in domestic policy, and to engage with advocates throughout the world. And I think what I'll add at the end is that a big part of decolonizing the human rights space and the global health space is recognizing that there are models from it's not that human rights are not an imposition of Western values on the world. Historically, they definitely were. But that this is now an ongoing global conversation, and that it's about all countries learning from all countries. And that is a real way of both reshaping the way we think about our role in the world, but also the way we reshape what human rights actually mean in the context of health. When we bring in non-Western models, non-individualistic models, and begin to think about collective rights and solidarity rights and other ways of thinking about what human rights mean in a ideally decolonial landscape moving forward.
So one thing that I think has been a consistent theme of the discussions today have been around the role that non-state actors and specifically for-profit actors or corporations play in the realization or not of human rights. And I was just sort of, as you were thinking about the ways in which human rights can support international cooperation and assistance and solidarity, I just wonder if this sort of state actor, non-state actor paradigm that we've been using all along is actually still suitable, or whether this gap is something that human rights needs to fill, and we need to start imposing obligations on non-state actors that are actually shaping the realization of human rights.
So this is one way that human rights will have to be reshaped. When we begin this focus in 1948, this Western model of human rights is really focused on individual rights holder, state duty bearer. And it's really about what individuals can claim from their own states. As we've grown beyond that original vision, we started reframing what the rights holder is and began thinking about rights holders in a collectivist way, started thinking about rights holders at a national level. and begun thinking about how we need to reshape international affairs in order to accommodate this larger shift to focusing on rights, not just for one's own populations, but throughout the world. Now, what you're raising is this question of who the duty bearer is. And obviously, in the COVID-19 pandemic, but we certainly saw it before that, we recognize that a lot of non-state actors are responsible for the realization of human rights. And yes, human rights needs to expand to recognize that. We're already beginning to think about the role of businesses in human rights. I would begin this by saying, when I start talking about the World Health Organization and human rights, when the World Health Organization was first created, no one thought that international organizations bore human rights obligations. Although they are developed by states that do, no one really thought, oh, the organization itself bears human rights obligations. But now I think every international organization, maybe not the World Trade Organization, but every international organization would say, although it doesn't bear a legal responsibility for human rights under treaties, they didn't sign or ratify treaties, they still accept their responsibilities as duty bearers under these human rights treaties. So non-state actors is just the next step in that progressive enlargement of what we think of as duty bearers, having already expanded our focus on rights holders.
Just to give you another example of what that might look like, Canada is one of the leading countries in the world as headquarters for mining operations around the world. And so every couple of months, you will get a headline in a Canadian newspaper in the business press that goes something like mining company X in African or Latin American country Y is violating, its practices are violating the rights of local people. And it becomes a political debate here in Canada. And so this idea that there are these things called rights and they create norms and obligations is being transferred by civil society actors who are saying, well, you may not be a government, but you must, we civil society, we, the people of Canada, and to some extent our courts, want you to behave in a certain way, right? I don't want to overstate the power of that, but it is something that would not have happened 30 years ago. And so I think there are examples where the broader civil society conversation is being used to sort of put pressure on non-state actors. And we also know that can, in the Canadian case, that can sometimes lead to boycotts. And so that there is an economic price to be paid by those companies for ignoring whatever these rights obligations that are put on. So again, I don't want to overstate this, but it is an interesting phenomenon.
But I think that's the challenge now, is how we go from corporate social responsibility to international legal obligation. And I think that's a continuing conversation, both to focus on the harms that corporations can cause, but then once we start talking about pharmaceutical corporations, to ask what obligation do they bear, not just to not cause harm, but to affirmatively do good, to progressively realize social and economic rights.
Other questions, comments?
Hi, everyone. Bonjour à tous. In thinking, so I'm just maybe taking things a bit broader, thinking about the INB negotiations. And I'm just thinking about how currently there are a few countries, just to take the US for as an example here, who have, you know, immense resource and influence, who are coming and negotiating in good faith, however, you know, may not adopt or ratify this pandemic agreement. I'm wondering how this example could influence the ultimate purpose of instruments such as this pandemic treaty. And just thinking about it out loud, and would, you know, love to hear your thoughts, because again, going back to solidarity, but in the end, you know, what's achievable and what's the purpose. So just, you know, acknowledging that there are many other such states, but it's the big example that comes to mind currently. Thank you.
So I'll just begin by noting that the United States doesn't ratify treaties. Our Constitution sets such a high threshold for ratification of treaties at 2/3 of our Senate that nothing could ever possibly be ratified at this moment and for the last 30 years. And we've long tried to push to have the Convention on the Rights of the Child ratified, and it's not going to happen. But that speaks to, I think, the broader issue that we're talking about with normative change, that the United States and other countries, even when they don't ratify a convention, nevertheless are influenced by the normative shift that happens with not just the ratification of treaties, but with the development of treaties. That we're beginning to start global conversations across governments about what people are entitled to as a matter of law. And that shifts government behaviors even for the countries that don't ratify these things. And it shifts all future legal negotiations because when future global health standards are being drafted, the pandemic accord, should it come to pass, will become the foundation for that latter legal development. So we need to recognize that it's not about who signs, who ratifies, it's about the development process itself, and it's about the shift in norms that happen at a global level because of it. And one of the hopes that I have coming out of this pandemic accord process is that the process of developing the pandemic accord will highlight the flaws in the COVID-19 response for governments that were not yet fully aware of it. I don't know how. And will also clarify the importance of global solidarity through global governance moving forward. And to the extent that that is the case, this will have widespread application when we talk about climate change, when we talk about pollution treaties, when we start talking about all these global public goods that can only be realized when governments come together. And so as these norms begin to shift, we'll begin to see new kinds of legal paradigms coming into being that we never thought possible in the past.
Great. So I'm conscious of the time. So I want to thank you on behalf of the people here today and people watching online. And I want to thank you for sharing your thoughts with us this afternoon. And on a gloomy December day, a note of optimism, I think appropriate given it is the 75th anniversary. And with that, we'll take a short break and we'll be back with the next panel